Keyhole surgery is a type of surgery where we introduce small instruments and small cameras into the cavities such as the tummy or the chest to visualize and to perform the surgery inside at the site of the organ, as opposed to delivering the organ out in an open surgery into the surface to do the surgery outside, or making a big cut in having the hands of the surgeon inside the cavity to the procedure. Camera is introduced usually for a child. I usually use a 3mm camera, so the cut is basically the same size as the camera, and then two other instruments, again 3mm each, to perform the surgery. So you end up with three tiny 3mm instruments, whereby you make a small cut in the skin and you push the instruments in without cutting the muscle. The muscle cutting is what causes the pain on recovery. So we don't cut the muscle, we just spread the muscle. Because you need to spread the muscle 3 minutes, it doesn't cause too much pain. And when you remove the instruments, the muscle just snaps shut. All you have to do is glue the skin together. So they recover very fast without much pain.
Glue the skin together, so meaning there's no stitching?
I hardly use stitches for the skin. The glue holds the skin together, and then within 4 days, the skin is watertight and the glue falls off, and leaving a very invisible scar in the end.
So with keyhole surgery, what are the key benefits for the patient or for the child? It seems to be a far less painful method.
One, the pain is minimal because we are not cutting much tissue.
Yep.
And two, there's not much of collateral damage. So you don't have to cut, for example, muscle tissue on the way to get to the area of interest. And thirdly, the tissues that we handle do not have to be manipulated, pulled out of the abdominal cavity or chest cavity very much. So minimal handling of the tissue and doing operation within that vicinity of the organ, you don't cause too much of paralysis or damage to the tissue itself. So basically what you see as a parent is tiny cuts on the outside, and inside there's minimal handling of the tissue.
Right. And that leads to also much faster recovery time?
Exactly, yes. So when you don't cut much muscle, they don't have much pain, and you don't handle very much of the tissue inside, things like the bowel will function very quickly. As opposed to open surgery where you open up the tissue, we open up the abdomen and you deliver the intestine out to get to the area of interest. And the intestine that's been delivered and handled will take a few days for it to start working again. So that will take at least 4 to 5 days before it starts going. So in keyhole surgery, the intestine work almost instantaneously because there's minimal disruption either by handling or by manipulation.
From the operation itself to recovery and going home, what kind of time frame are we typically looking at?
Even for simple operations like appendicectomy, if it's straightforward without any perforation, the child may go home the next day or the day after.
Oh wow, okay.
And in more complex surgery, which I do for reconstruction, for example, a child with a very dilated common bile duct, the duct that leads from the liver to the intestine, draining the bile, that is a very unusual, complex operation, and the children can go home within 2 days as well. As opposed to an operation for vasectomy, for an open procedure, it take 3 or 4 days before they can go home, minimum. And for choledochosis, where the duct is abnormal, they take a minimum of 7 days before they go home. So that's the difference. Many days in hospital versus few days. And also the stays in the hospital will disrupt the child, disrupt the family functioning. All that is an added cost.
Of course. I assume also when it comes to recovery, scarring is a problem, right? And I assume with such a small incision, the scarring is minimal.
Yes, so you look at scarring inside and outside. What you don't see is the scarring inside. So when you handle the intestine inside, there's a lot of scarring or adhesions inside. So that can cause other problems in bowel obstruction in the future. That's in the magnitude of about 10% if you do open surgery. Minimally invasive surgery does not have that kind of risk. And the scarring on the outside will heal very quickly with keyhole surgery, and you can hardly see the scars. And by open surgery, you often cut muscle, and that can cause deformity of the muscle. And for example, the significant deformities that we see are the ones that we do open surgery for the chest. So any condition in the chest where we do surgery for neonate or newborn babies or younger children, they can have deformity of the chest wall. And also that can lead on to scoliosis or deformity of the spine. These are all risks. And the magnitude of this risk is about 40%. So 40% of children who've had chest operation and the open technique will have a chest wall deformity or spinal deformity, which is significant.
Yeah, absolutely. So there seems to be a huge amount of benefits when it comes to keyhole surgery. But from a very practical point of view, is keyhole surgery more expensive than open surgery?
Cost is slightly more for the operation itself because there's more equipment being used, but the cost is not excessive. So if you compare the cost of the operation and the cost of the hospital stay, it would be compensated. If you compare open surgery and keyhole surgery, I think the overall cost is almost identical. But the recovery is much faster because the overall stay in the hospital is less. Therefore, that cost is saved, and then that will be compensated by the cost of the equipment in theatre. So I think it's identical.
Less scarring and more peace of mind. Parents are able to get back to their routine much faster than with a longer stay in hospital.
That's right. So you wouldn't want your child to suffer with pain for longer. So I don't see any benefit in open surgery when there is such a amazing benefit that you can do keyhole surgery for children.